State House leaders introduced a bill that would dip into the rainy day fund for a cure.
It sets aside $100 million from the rainy day fund for us to use only as needed and if needed.
This is a cancer on the balance sheet of the state of North Carolina, the taxpayers, and the state employees.
Debate on the bill focused not only on the ailing state health plan, but also on how to fill the void. One recommendation: cut the newly passed $21.4 billion budget by 1%.
In your opinion, to resuscitate the state health plan, given the opportunity to do it in July and not having to wait in January to possibly do another reversion, because that makes it doubly painful to the head of these agencies, do you think it would be better to do it now as a preventive measure and get the money we need to reserve this state health plan the way it should be by doing a reversion?
What we're looking at is a possible shortfall, and if we have one, we'll need to be able to move money immediately, not wait and say go to the governor and see if he can find the money somewhere in the department, which might take 6 weeks, 8 weeks, or 3 months to find. We need to be able to handle claims as they come in.
We continue to spend and spend and spend and save less and less and less. Folks, when you look at the reasonable fiscal conservative alternative, the only option we have is to tighten our belt.
If you give him that, whatever the 1% is, he can take it out of repairs and renovations or any other fund that we have here. This restricts it to the savings reserve where you don't have to bother the other agencies.
Most agree the entire state health plan needs a major operation.
Until we can get younger people, state employees and their spouses and their children, until we can properly reward them for coming on the state health plan, we're going to continue chasing our tail.
No matter what, lawmakers predict big headaches ahead for the state's health plan.
If we do nothing and nothing happens, probably a 30% increase. But, we hope that we can do some things to mitigate that where it's not quite that big.
There are those who say, you ought to take it all out of the rainy day fund. Well, that doesn't stop the bleeding. All that does is you're eating your seed corn where you need to be, planting for the spring. We got to get this thing under control, and we got to get it back in a fiscally sound position.
Senate